Hello, I am Dr. Girija R Varier. I am a fetal medicine consultant at Institute of Fetal Medicine, Kolkata. Today I will be giving you an overview of how a fetal medicine department works and how a fetal medicine department contributes to bringing about a very healthy outcome of a pregnancy. When you look at a pregnancy, there are two different units in a pregnant woman which are functioning together. One is the maternal unit and one is the fetal unit. Now these two units work in a very interrelated way, and they are communicating through a highly vascular structure called placenta. So it is the maternal unit that is taken care of by the obstetrician. So whenever a woman turns pregnant, when her pregnancy test is positive, she goes to an obstetrician. Obstetrician examines her clinically, sees her pulse, BP, weight, gets her blood tested for anemia, for thyroid and sugars, etc. Advises a lot of pregnancy scans and also advises her as to what should be her diet, what medications she should be on, how much rest she should be taking, so on and so forth. So a maternal unit is taken care of by the obstetrician. Now who takes care of the fetus? So the welfare of the unborn baby is taken care of by the fetal medicine department. So looking at it that way, a fetal medicine consultant is a physician of an unborn baby. Now, what are the different parts of a fetal medicine unit? In a fetal medicine unit, the most important part is the fetal scans, what we call as the fetal imaging. Now, for fetal imaging, we use an ultrasonography machine which has no effect of X-ray irradiation on the fetus. So, in every trimester of pregnancy, certain scans are prescribed by the obstetrician, and none of these scans are going to harm the fetus. As many times as you want, you could go ahead and do them. So, that is the fetal imaging where various tests are done, namely the viability scans, the first trimester down screening, the anatomy scans, fetal echocardiographies, growth Doppler studies, and we also do some special tests like cervical scan screening to see the cervical length, whether we can predict whether there will be any kind of abortions, or whether the environment surrounding the fetus is good, or if the environment is hostile, like if the liquor is less or the placental bed is not having enough vascular flow, then in those cases we actually decide on terminating the pregnancy prematurely. So these are the ways in which a fetal imaging department helps in a pregnancy situation. Now, once the fetal imaging is done, there are certain blood tests which we do along with the scans. These are called the combined screening tests. Now, how these tests help? When the reports of the ultrasonography and the blood enzyme levels are added upon, we generate a risk prediction, which is called, we categorize the fetus into a high risk, intermediate risk and a low risk fetus. Now those pregnancies where the fetuses are falling into a high risk category for aneuploidies or chromosomal abnormalities, those are the cases where we take them to the invasives. Now what are the invasive tests? Prenatal invasive tests can be done by taking the fluid which is surrounding the baby or taking a bit of the placental tissue. So these tests are done to confirm the chromosomal abnormalities or the genetic abnormalities that the baby is suffering from. Now depending on whether the baby is normal or not, they are subjected to a counseling. Now this counseling involves the father and the mother and some of the family members who could be present to inform them on how the fetus is doing. If there are certain abnormalities like structural abnormalities or chromosomal abnormalities or genetic abnormalities, then the whole situation is explained to them so that mentally, physically and financially they are prepared to face the situation if they decide on giving birth to that baby. Otherwise, if they decide on not continuing the pregnancy, that information is also given to them so that they can take a best decision depending on the available reports. there is a situation where the baby is detected with some genetic abnormalities or chromosomal abnormalities. In that case, they are also referred to a genetic counseling. So this genetic counselor is going to explain to them how this present situation, present chromosomal or genetic abnormality has affected the baby and how it is going to affect the future pregnancies. So this helps the parents to understand where they stand, whether the chance of this abnormality is going to be repeating in the next pregnancy, or in certain cases we find the earlier child fetus or the earlier baby has some abnormalities, then whether the present pregnancy is standing at a risk for repeating the same. So this is the overview of how a fetal medicine department works. So as I put it, in short, fetal medicine expert or the fetal medicine consultant is the physician of an unborn baby, and they work in a very interactive and interdisciplinary manner with the obstetric wing to help the mother to give birth to a healthy baby. Thank you.